Yeah, let's talk about the basics of how to use this during labor. So it really does help with back labor. So you've had back labor before, or you've noticed that when you have Braxton Hicks or cramps, that it happens more towards your back. This is something that I would really recommend getting. Even if you don't have back labor, I would still get it. But I would recommend using this like further along in labor. Like when you are hitting a point where like, oh my gosh, this really is awful, I need some extra help. I would use this, I would use water. There's a couple other things, but let's talk about this one today. So one, make sure it's fully charged. So it just charges in a port like an iPhone does. But you're gonna open it up and it looks just like this on the inside. So these things are the things that are charged and you attach it to the sticky pads. I'll show you. When you open it up, you will see that there are parts that are being charged and there's sticky pads. So you're gonna take the ports out and then you're gonna take the pad out too, and you're gonna attach it to it like this. It's like a little magnet and you stick it on. And then you're gonna take off the little pad to see the sticky part. So this is what the back side looks like, the sticky part. So you're gonna attach it to your skin, and I suggest attaching it to your lower back. I'm gonna show you what it looks like attached to like my knee because I can't show you my lower back. So you're gonna turn it on and then you will hear it turn on. And then you're gonna pump up the volume. Volume is what it looks like, but you'll feel the stimulation. So I can feel the stimulation already, but if you want more of it, then you can keep turning it up until it feels good. So this one's like an off and on pulse, but there's a different mode that you can do that'll feel better. It's like constant or every so often. So make sure you practice with these before you actually go into labor so you know what you like. So every time you push mode, you actually have to turn the volume, the pressure up. I'm not sure what that right word is, but like this one's a pulsing one. Anyway, so make sure you practice with it. Put it on your lower back. Make sure you practice with this before you go into labor. Adjust the settings, adjust the control, the power. Make sure you place it on your lower back, right? So a part that maybe feels tense or tight. You can lower it like right below your hips or right on your hips. Practice it in places you think that would feel good and just test it out. See what feels good before you go into labor. And then you'll know right where to put it. If you didn't see my previous video, this is a TENS unit with electrical nerve stimulation. So the electrodes will actually help alleviate a lot of pain, especially back labor in the muscles. So this is a great tool to help with natural birth. If you have any questions, ask them in the comments below.